Identifying the window when your body is ready to conceive requires a real-time indicator. You can track your fertility status day by day by observing cervical mucus, a fluid your body naturally produces every cycle. Many popular tracking methods leave you a step behind. Basal body temperature, for example, is helpful, but a temperature spike only confirms that ovulation has already happened. By the time you see the shift on a thermometer, the optimal window for conception has closed. This chart compares 3 common ways to track fertility. Ovulation predictor kits are chemical indicators that detect hormone spikes, but they cannot confirm if your body has created the physical environment sperm need to survive. Cervical mucus, however, is a real-time physical indicator. Traditional Chinese medicine views this natural fluid as an external map of internal health. It reflects the dynamic transformation of yin, yang, blood, and essence occurring inside your reproductive system. These daily shifts indicate when the internal environment has transitioned into a state that supports conception. Right after menstruation, the body focuses on protection. The uterus secures itself, creating a barrier to block sperm entry. You will typically notice a dry sensation. During this phase, there is little to no visible discharge, and the cervix remains physically closed. In the framework of TCM, this is the yang phase of the cycle. Yang energy is dominant, causing fluids to contract, while yin energy has not yet begun to expand. A few days later, you move into the early pre-ovulation phase. This is characterized by sticky or creamy fluid, indicating a state of low fertility. You can identify this by its white or pale color. It has a thick, lotion-like texture with minimal stretch when pressed between your fingertips. This texture reflects the earth phase of nourishment in TCM. The spleen begins building fluids, preparing your body for conception, but hasn't yet transformed them into fertile essence. As ovulation approaches, your body shifts into active fertility. This is marked by the arrival of the watery phase. The physical signs become much more obvious. You will observe an increased quantity of fluid that feels slippery, thin, and wet. This 28-day timeline illustrates your cycle's hormonal and energetic shifts. Right before ovulation, the estrogen curve rises, what TCM calls flourishing kidney yin. Simultaneously, liver blood softens reproductive tissues. The Ren vessel opens, allowing qi and blood to flow toward the reproductive center. The watery phase acts as a biological bridge. It completes the transition away from defensive preparation, bringing your body into a state of high fertility readiness. This brings us to the peak of the tracking cycle. Egg-white cervical mucus. You confirm this phase by checking specific benchmarks. The fluid must be clear, transparent, and capable of stretching 5 to 10 centimeters between your fingers without breaking. This specific texture has a distinct physiological function. Its elasticity is designed to protect, nourish, and transport sperm toward the egg. Looking back at our timeline chart, this indicates the highest point of kidney yin expansion. It aligns with the maximum opening of the Ren and Chong vessels when the uterus is fully nourished. This optimal window typically lasts 24 to 48 hours. It represents a peak yin state, occurring just before the yang transformation of ovulation begins. Once you pass that ovulation window, the environment changes over the next day or two. You will observe a rapid reversal. The fluid returns to a thick, cloudy, and dense state, bringing back a sensation of dryness. The main hormonal driver for this change is a rise in progesterone. Your body is closing the uterus to protect a potential implantation. In TCM terms, your body transitions out of yin expansion and into a warming yang state. This internal heat causes the fluids to condense. This return to dryness confirms that the active fertile window has closed and the protective mechanisms are back in place. Tracking these daily observations over multiple cycles gives you long-term diagnostic data. If you review your chart and notice that you are consistently missing the watery or egg white phases, it points to a disruption in your reproductive system. Ovulation cannot occur without the development of fertile mucus. This radar chart maps insufficient fertile fluid to 5 specific internal imbalances in TCM. A lack of fertile mucus indicates you may be dealing with kidney yin deficiency, blood deficiency, internal dryness, qi stagnation, or excess heat consuming your fluids. Because you have logged the specific phases that are missing, you have the necessary details to consult a TCM specialist or acupuncturist. They can use these observations to target the correct organs for repair. Daily observation of cervical mucus provides a practical audit of kidney essence, liver blood, and reproductive hormones.